COVID cases and deaths have been sharply decreasing for the past few weeks. But according to offguardian.org and health experts, this is not because of lockdowns nor vaccinations.
So what is the real cause for the decline in COVID cases?
Some experts are saying it's too early for vaccination programs to have stopped a virus. Dr. Wafai El-Sadr, professor of epidemiology and medicine at Columbia University's Mailman School of Public Health, said, quote, "The falling case numbers can't be attributed to the COVID-19 vaccine, because not even a tenth of the population has been vaccinated, according to the CDC," unquote. Plus, this decline is happening throughout various countries despite vaccination rates varying wildly. And also consider that the vaccine types being used are not even the same. So then are lockdowns causing the decline? In a previous article, we covered how this was not the case in Florida. And Sweden, who also never locked down at all, is showing their cases also declining in parallel with the UK. According to Johns Hopkins University, the global decline in COVID deaths started during mid to late January.
So then what's causing the decline of COVID cases? A memo published by the WHO could be the reason.
On January 13, the WHO also published a memo suggesting positive asymptomatic test results should be repeated because of unreliable PCR tests. In other words, you can take a PCR test and be incorrectly labeled as COVID-19 positive. That's why now you should be tested twice. So now, because it's much harder to be incorrectly labeled as asymptomatic, it's possible we're not really seeing a decrease in COVID cases or deaths at all.
Are we then actually seeing a decline in healthy people being incorrectly labeled as asymptomatic? And are we seeing fewer deaths of pneumonia, cancer, or other diseases that had COVID-19 falsely attached to their death certificate?
Do you remember the uproar of hospitals supposedly inflating their COVID-19 deaths because of financial incentives? You be the judge. But, when even the WHO admits their test results are unreliable, this provides even more concern. Based on the WHO's new suggestion, then what would have been the actual numbers ever since this started?
Could the inflated numbers been used for an engineered crisis and totalitarian takeover?
And what I'm really curious about is,
who will take credit for the decline in cases?
And what will be their motive? If Biden were to credit lockdowns and vaccines for this decline, wouldn't it be now much harder to believe? And if he does credit these medical mandates for the decline in cases, will the new normal be pushed with no end date in sight? Perhaps it's time to prepare for the worst. To start preparing, visit firstchoiceman.com/prepare.